Doctors of Reddit, what is the biggest lie your patient has ever told you? When I was an intern, I was doing my ER rotation and a woman in her late 30s also came in complaining of nausea and lower abdominal discomfort for the last few days. I did the diligent history taking and of course asked her about the possibility of her being pregnant. She lost her shit and went off on me, said she was a les woman and had not been with a man for 10 plus years. Yelled at me to get my boss and let an adult treat her. I reported back to my attending and delineated the tests I wanted done. He was like, I didn't hear a plan for a pregnancy test. And I was like, I don't think that's needed, she's a les and hasn't been with a man in 10 years. My attending smiled and said, humor me. Itch was pregnant as duck. Went back to her room and there were two dudes mean mugging one another about to fight. She couldn't even look me in the eye. EMT. Not the patient. But the wife was getting the patient to take him to the doctor. I asked him if he could stand. The wife told me he hasn't walked in 30 years. The dude stands up unassisted and walks to the stretcher. I've been in this work a long time and simply don't give a duck about a lot of stuff. So I just blurt out holy shit. It's a miracle. I was prepared to get in trouble never happened. A few years ago, a man came in complaining of a terrible cough, chest pain, and fatigue. I asked him if he had a history of smoking. Naturally he said no. Around an hour later, on my way home, I stopped to get some food and there he was, smoking outside McDonald's. Patient presented with unrelated complaints, but on the standard intake for our clinic we were to ask whether the patient had used any injected Drugas in the last month. He was wearing a short-sleeved shirt. As I asked, he looked down at his arms, exposing his numerous track marks or syringe puncture wounds on his arms. He then looked up at me, crossed his arms obscuring many of the track marks, and proudly stated, "Nope. Never." Yikes, I don't understand why people would lie to their doctor. At best it makes their job unnecessarily difficult and at worst the treatment could be wrong or dangerous. I really did get a light bulb stuck up my butt from falling onto it though. I don't recall why I wasn't wearing any pants. In my first crappy job I would take sick days constantly. I learned how to fake certain symptoms, have a cracked voice and all that. I always wondered if the doctor saw through my sheet but did not want to call me out or just did not give a shit at all. Because one day I went to another doctor. He called me out and sent me to work. Funnily enough, I actually became sick the very next day with flu. Came back to the same doctor and he apologized that he never knows for sure and there are a lot of people faking symptoms to get things in flu medicines that you can make meth out of. I had a lady in the hospital who was several days post-op and had met all criteria for discharge. This can be a somewhat difficult situation because you want to maintain a good relationship with your patient, but at the same time can't inappropriately use hospital resources. I told her that if there's no medical necessity, insurance could deny payment for the extra night in the hospital. To which she said, "Oh, my health insurance agent was just up here and he said I should stay another day." I just stared at her for a minute since I have never seen an insurance representative in the hospital and don't even know if health insurance agents exist. She then admitted that she just made that up. Not a doctor, but I was an ER scribe. I would follow the doctors around with a laptop and do all of their electronic charting, ordering tests, note taking and stuff like that. Had a patient, probably around 18-20-year-old male, complaining of a foreign object in his male organ. He had a set of iPhone headphones stuck up his pen 15. And when I say stuck up there, I mean all the way to where the single cord splits in two for the two earbuds. Out of precaution we did an x-ray and sure enough, you could see the knotted up cord in his lower abdomen and it was going to require surgery to remove due to it being tangled. He said that he was at a party with some friends and that he got drunk and passed out and his friends shoved it up there as a joke while he was passed out. Luckily the doctor I was working with had seen this guy for the same thing not long ago, except before it was a wire coat hanger. She recognized there was a bigger issue and convinced him to have an inpatient psych consult in the ER after surgery so they could get him the help he needed. Not a single person in that exam room bought his story that his friends did it to him though. Not a doctor, but I work in an ER. Had someone come in and was acting erratically from the get-go. Went back into his bay and he was with his lady friend and they were looking at mosquito bites along their arms and legs. He went on to tell me about how they go hiking every Sunday and get torn up by bugs, but every single bite on both of them was scabbed and along a vein. I'm a veterinarian and people do the same shit. Dog comes obviously intoxicated with something and you ask if he could have possibly consumed X drug, depending on the dog's symptoms, and people don't want to admit anything. I don't care WTF you do to yourself. Have at it. But don't let the dog suffer by not being honest and therefore preventing or at the very least delaying appropriate treatment. Nurse practitioner. I work with patients with substance use disorder. Many of them must have their urine spiked by our staff. Or someone slipped drew guts in their food or drink. The worst is when they are testing positive for their meds but not the metabolite, meaning they took today's pill but probably sold yesterday's, and they try to talk about having fast or slow metabolism. Only a medical student but a patient I took history from wanted Ativan for anxiety. She was telling me about how her panic attacks are so bad she gets into car accidents with casualties every week. I mean, a lot of patients will tell lies or play coy to get controlled substances, but she was the only one who admitted to multiple counts of vehicular manslaughter. When I presented her case to my attending, she showed me a note in the EMR from another doctor stating this was a regular tactic of hers, as well as an extensive online list of every script different doctors had given her for controlled substances. She didn't get an Ativan prescription that day. Not a doctor. But when I was 6, a friend and I were playing doctor. The patient claimed they were unconscious. I kicked him and found out he was lying. I don't drink a lot of water. The patient was drinking 21 bottles of water a day and was making herself hyponatremic, low sodium in the blood. She was basically diluting herself. This can lead to lethargy, seizures, death. The medical diagnosis is called psychogenic polydipsia. Not a doctor. But in college, my roommate, who I wasn't particularly close to, showed up in our room stumbling around drunk. There had been a home football game. So I didn't think anything of it. An hour later she's acting dangerously drunk. But was insistent she didn't have anything to drink. So I decide to take her to the ER. Turns out she's diabetic and didn't think that was an important detail to mention to the doctors at any point in the 3 hours we'd sat there. The doctor only realized it when her blood tests came back. Although she admitted that she's known for years and took daily insulin shots, that she also never told them about. My doctor wrote in his notes, I'm able to view them online, that he thought I was covering up a domestic abuse issue by lying about not knowing what hit me in the head when I came in 4 days after the fact with a massive eye head bruise. Complaining of a chronic migraine. I have hypothyroidism and legit have the worst memory possible. I also am a practical human battle tank and can get hit by a car and think I can just walk it off and then wonder the next day where all the bruises came from. It's been 3 years and to this day he still looks me dead in the eye with concern that my husband beats me. Not a doctor. But a former patient who once told a weird lie that I was dead is called out on. I had braces as a kid. And I had a bad habit of chewing on pen caps, which would occasionally result in one of my brackets coming uncemented from its tooth. So for the upteenth time, this happened. And my orthodontist got ready to read me the riot act. But then I told him that, actually, I had been at a birthday party at a restaurant that had a dance floor in the back, which was true, and that I tripped and fell and hit my mouth on the wooden railing that lined the perimeter of the dance floor in such a way that I didn't hurt myself. I just knocked a bracket loose, which was absolutely a lie. And he was like, so you fell into a wooden rail, and you hit your mouth into it, full force, but you didn't lose a tooth, or bust your lip, or anything else? Is that what actually happened? And then I looked at the floor and shook my head no. Lots of my patients conveniently lose their controlled substances. have them stolen, or drop them in the toilet. Or once some guy claimed the pharmacy defrauded him by saying he picked up his pills when he never did. That awful pharmacist must totally be stealing his Xanax. Oh. And once airport security confiscated them, even though they were in their clearly labeled original pill bottle. I had a patient lie to me that she was abducted and raped after she regretted a foray with someone she met at her mosque. She also said the police who came over to the house neglected her. However, she has a brain injury from suffering meningitis as a toddler. So unfortunately, compulsive lying is part of her chronic condition. So the family and I could not get too pissed off at her. Eventually, she admitted to lying, so we at least avoided filing complaints against the police department and filing criminal charges against her abductor. Mind you, considering her developmental delay, him taking her home to have sex with her was still wildly inappropriate. I was waiting at the dentist's. I arrived way too early, and a teen and his mom comes in. They talk to the dentist and his mom says he has been grinding his teeth. He acts like she attacked him and was like, I do not. I never grind my teeth. Then 10 minutes later the dentist comes back with the kid out to the waiting room and tells the mother there is severe grinding happening and he is at risk of getting severe cavities since all the enamel is gone and he is wearing into the teeth. The look on his face was priceless. He then said they would have to go upstairs to the orthodontist and get a mouth guard for sleeping and that the kid will always have to be vigilant that he isn't grinding for the rest of his life, or something like that. Customary. I'm not a doctor. I did overhear someone in the room across the hall in emergency that had told doctor she was pregnant. Turns out she said that to get in and was soon found out after some blood tests. I got to hear him confront her too. It was awkward. She said maybe I lost the baby? Then kind of shrugged and left. My father is a urologist. The amount of patients that come in with a broken or bruised pen 15 is astonishing, to say the least. Some are honest. They were trying some new sex thing and they miscalculated or got carried away. Then someone turns the wrong way or falls off the bed, pommel, horse tire swing, etc. Or took a flying leap to initiate sex and missed. But some of them are adamant that they woke up like that. These are the same people whose wives are out of town. And a woman who is definitely not her is in the waiting room to see if her boyfriend is okay. My dad has the potential to nuke so many marriages from orbit. But doctor-patient confidentiality holds him back. I have often dreamed of what would happen if one day he just said FCK it and revealed everything. Someone attacked me and set me on fire. Turns out he set himself on fire. And also ingested some substances that ended up greatly complicating his treatment. They weren't things that are routinely tested for. Or even easy to test for. He died. I'm not a diabetes patient. But one time I got a small gash on the inside of my wrist at work at 8 AM in the morning. Had to go to the clinic for 3 stitches and because of where the cut was I had to answer some mental health questions and they asked me if I was depressed and I said nope. Not DR but nurse. Patient in ER had a very low BP. Turns out she is hemorrhaging from her ruptured cervix. DR asked about her last sexual intercourse and if they used any toys. She lied and said it was only her boyfriend's pen 15. Google. No.